All right. Hi, everybody. This is Real Talk with Miss Wendy. We're going to go ahead and jump into Chapter 8 test review. That's hair and scalp disorders and diseases. Just remember, I do not know the answers to every single one of these questions. I get tripped up just like you do, but we're going to go over it. That way, when you sit down to do your test, it's kind of fresh in your head because you've listened to me, hopefully, before your test. So, I will go through them. I will look at the answers. We'll decide which one is the correct answer. You're going to look for certain things that Milady likes to throw out there, like say they may say always, or they may say except. Those are clues to help you. They may give you the answer to one question in another question. Those are going to help you. If you do not know the answer to the question, if you is an absolute guess, you cannot narrow any of it down, you're going to choose B. B is the most common answer. If you choose the same answer every time, you're more likely to get some of them correct. So if all else fails, choose B. I do not know everything in the book. I may get some of these wrongs. I do have my answer key. So we will take a look at those and make sure that we've got the right answers so that you are well prepared for your test. So let's get into it. Question 1. Which of the following is a reason cosmetologists should understand hair and scalp disorders and diseases? Well, there's a lot of reasons, but let's go with one. So, A, cosmetologists can better recommend client hair loss treatments if they can identify the differences between common and irregular hair loss. That sounds completely appropriate, but let's make sure. B, cosmetologists cannot recommend the use of minoxidil or finasteride unless they can identify the cause of the client's hair loss. That's not true. The proper use of cold caps as an option for chemotherapy patients requires an understanding of how hair and scalp disorders lead to hair loss. That is true, but that has nothing to do with why we need to understand hair and scalp disorders and diseases. D, cosmetologists must be able to identify the type of fungal infection to know how to disinfect a client's scalp before performing services. All right, so based on all of those, which I hate reading the long ones, I'm sure you do too, but we got to do it. A is the most likely answer. Let me go ahead and just check. A is the answer. Cosmetologists can better recommend client hair loss treatments if they identify the differences between common and irregular hair loss, right? So there's a big difference between, oh, you're losing a little bit of hair because you're postpartum, or you're losing your hair because of chemotherapy, right? So that's the answer, A. Number 2, which type of alopecia is defined as hair loss in round or irregular shaped patches caused by the immune system attacking hair follicles? All right, so out of these, we've got androgenic alopecia, alopecia totalis, postpartum alopecia, and alopecia areata. Now, I do believe the answer is alopecia areata. I'm going way back to my hair school days. It's something that always stuck out for me. Alopecia, we know, is hair loss, right? That doesn't change. Alopecia is hair loss. Areata is hair loss in patches. So that's the one that it has to be. It's the only one that goes in patches. So it's the immune system attacking hair follicles in patches. Number 3, the following are all causes of hair loss except, love that word. So what are some reasons why you would lose your hair? Pregnancy, sure. Insufficient diet, absolutely. Extreme stress, we're going to talk about that. Autoimmune disorders, that is true. So the following are all causes of hair loss except extreme stress. That is what the book is going to tell you. So here's the thing. I know from behind the chair, I know from personal experience. If I am under a lot of stress, then I'm more likely going to experience some hair loss. Am I experiencing the hair loss because of stress? Not necessarily. It's probably because I'm not sleeping correctly, I'm not eating correctly, I'm not taking care of myself. So that is going to cause, the hair loss. But extreme stress, according to the book, is not a reason why you would cause hair loss. Okay, so the answer to number 3 The following are all causes of hair loss except C, extreme stress. So that's the difference between what the book tells you and what behind the chair knowledge tells you. Um, I've been a hairstylist for almost 30 years. I've taught for the last 12. And I can tell you that if someone is under extreme stress, they will experience hair loss, but it's probably not because of the stress necessarily. It's because of other factors that you are causing because of the stress, if that makes sense. All right, number 4. Which of the following statements is true about alopecia areata? Well, we already know that alopecia areata from up here in question 2 is hair loss in rounder or regularly shaped patches. So, which of the following statements is true about alopecia areata? Alopecia areata most often begins in childhood. It's most easily identified by scalp inflammation. It's known as male pattern baldness, does not affect women, causes the loss of all terminal hair on the body. All right, well, the only one that could possibly make sense is A. Let me just check for A, yeah. Alopecia areata most often begins in childhood. It's something that you're going to experience. It probably is caused by the immune system, so that's something that's going to begin way early. Scalp inflammation doesn't necessarily have anything to do with it. Alopecia areata does not necessarily cause scalp inflammation. It is not male pattern baldness, and it does not cause the loss of all terminal hair on the body, which is your regular hair, not like your little face hairs or anything like that. Terminal hair is like your hair. So the answer to that one is going to have to be A. 4 is A. So that's the answer. Let's go to number 5, another long question. We love these. All right. And I've read this question actually earlier, and I take issue with it, but let's go through it. A client expresses frustration with continued thinning hair following a prolonged medical situation during which the client did not receive adequate nutrition. On the advice of the healthcare provider, the client followed an improved nutrition diet, but after 2 months, there has been no improvement in hair density. What advice should a cosmetologist give the client? Milady's very big on this. So A, the client should consult the healthcare provider about the possibility of using a medication like minoxidil or blah, blah, blah. B, the client should consider a temporary option such as wig or hair extensions as the hair growth is unlikely to improve. C, the client should continue the improved nutrition diet and wait for the results as there's not been enough time for the hair follicles to regenerate. Or D, the client should take a pregnancy test as pregnancy can lead to hair loss. Okay, I take a little bit of an issue with this because the actual answer, let me just verify 5, yes, is C. That you should continue to wait for those results because there hasn't been enough time for the hair follicles to regenerate. That is the most correct answer. It's not going to hurt them to talk to a doctor about minoxidil or some other type of stimulation growth treatment. It's also not going to hurt them to talk about hair extensions or a wig. But the key there is it says, as the hair growth is unlikely to improve. Well, if they have adequate nutrition after a medical situation, their hair should improve. There should be no reason why it shouldn't. Pregnancy can lead to hair loss. So all of these other 3 kind of fit in, and that's what trips you up. But the most correct answer is going to be C, that you should continue to have the client use nutrition diet and wait for the results because there hasn't been enough time to regenerate the hair follicles. So while all of the others do fit, C is the most correct answer. All right, number 6, the complete loss of all body hair. All body hair is known as alopecia universalis, alopecia totalis, alopecia areata, or androgenic alopecia. I do believe, I don't know if it's between A or B, to be honest with you. Let me just take a look. 6A, universalis. Okay, and I'm probably going to get some of these words wrong. I don't do well with sounding out words. I can recognize them when I see them, but I don't always sound them out correctly, so don't come for me. The answer to number 6 for complete hair loss is alopecia universalis. Totalis looks right, but that is just on the head. Areata, we know, is uh, patches. Androgenic alopecia, I believe, is the one that you get in old age. So don't come for me if that's wrong. We know that it's alopecia universalis is what they're asking for. Number 7, temporary hair loss experienced at the end of the pregnancy is called, okay, I'm going to look at these real quick, but postpartum stands out for me. Congenital alopecia, postpartum alopecia, involutional alopecia, I don't even think that's a thing, and androgenic alopecia. So let's go with B, postpartum alopecia. Number 7 is B. All right, number 8, which hair disorder causes terminal hair to grow in areas of a woman's body where terminal hair typically does not grow? Okay, so terminal hair is like your actual hair. We're not talking about lanugo hair or baby hairs or anything like that. We're talking about hair. So where would hair grow on a woman that it doesn't belong, right? It doesn't typically belong. That's what they're asking, is what does that cause? What is that? What is the name of that? So we've got hirsutis, hypertrichosis, monolithics, or conides. I believe it's hirsutis is when women grow like beard hair and facial hair where they're not supposed to typically grow hair. So number 8 is A, hirsutis. Okay, so that's when a woman grows beards and stuff. They're not typically supposed to do that. So you have hirsutis if that's your issue. Number 9, which sentence best describes a client with the disorder of monolithics? Okay. I'm looking at them, so let's read them. The client's hair has alternating bands of gray and pigmented hair throughout the length of the hair strand. Don't think that's it. The client's hair is longer or thicker than usual. Don't think that's it. The client's hair is knotted and brittle. I kind of like that one. And the client's hair has beaded appearance due to narrowing of the hair shaft. I'm going to go with it's either C or D. Let's look. D. The client's hair has a beaded appearance due to the narrowing of the hair shaft. So, the answer to which one describes monolithics is going to be the D, that the client's hair has a beaded appearance due to the narrowing of the hair shaft. All right, number 10. Identify a true statement about congenital conides. Conides can be present at birth. Conides can be caused by the narrowing of the hair shaft. Conides can result from age and genetics. Conides can result from extreme stress. Number 10, let me look it up. Okay, conides is gray hair, right? That's what, I'm probably not saying that right, but conides is gray hair. So you're not going to get it from narrowing of the hair shaft. It can result from age, and it can result from, well, they say, some people don't believe that, but it can result from extreme stress. The problem here is where it says congenital, right? That's something that you get at birth. If it's congenital, you're going to get it at birth. So the only answer that makes sense is conides can be present at birth. Number 10A. Each of the following hair disorders is characterized by brittle hair except, okay, so all of these are the same except one, right? That's what that means. Trichorisis nodosa, monolithics, hirsutis, and fragilitas cranium. All right, so I do know, but we looked back here, that hirsutis is where you grow hair where you don't belong, right? So that has nothing to do with brittle hair. So I'm going to go with C as hirsutis for number 11, and that is correct. Hirsutis is the answer. It's the only one that doesn't have to do with brittle hair. All the other ones do. All right, which treatment is recommended for a client with trichorisis nodosa? Well, this one told me that it was brittle hair, so I kind of got a clue. The medication minoxidil, softening the hair with conditioners, laser hair removal, or cutting the hair above the damage. Well, if trichorisis nodosa has to do with brittle hair, we're going to either B or D, right? Let's go with B first. Number 12 is B, softening the hair with conditioners, right? So it's brittle. It's not necessarily breaking, but it is brittle. So we're going to soften the hair with conditioners for that one. Number 13, what would result if a cosmetologist is treated with trichoptilosis by conditioning and moisturizing the hair? The client's hair will see improved growth potential. Nits would dislodge and be removed from the hair with a vigorous washing. The hair would be softened, but the damage would not be repaired. The hair will be thicker than usual, which will camouflage thin spots. Okay, when a client has trichoptilosis, we're going to go with C because yes, it would be softened, but it's not going to do any repair to the actual damage. When I see the word trichoptilosis, I automatically see chop. And that tells me that that is a situation where you need to cut the hair. Okay, so I'm going to go with C. Number 13 is C. The hair would be softened, but the damage would not be repaired. So if the hair needs to be cut, can you get away with not cutting it? Sure. Can you condition it? Sure. It's going to soften. It's going to put a Band-Aid on it. It's going to repair it a little bit. But it's certainly not going to be repaired. It's not going to be fixed. So that's the answer. C. 14. What is a condition that is characterized by brittleness and the formation of nodular swellings along the hair shaft? We've got fragilitas crinium, trichoresis nodosa, alopecia areata, or hypertrichosis. Okay, I do believe it's trichoresis nodosa because that's the one with nodular nodosa, right? That looks good to me. Number 14 is B, trichoresis nodosa. They kind of give it away with their question, right? We know all our areata is spots. Fragilitas crinium, I believe, is just like really fragile, super fragile hair. And hypertrichosis is too much hair. You're growing too much hair all over your body. So the only one that makes sense, and the answer is right in there, is nodosa for nodular swellings. What is the technical term for beaded hair? Kinnides, we know is gray hair. Hyperkeratosis, trichinosis, or monolithics? I cannot remember the answer to this one. 15, let's look. D, monolithics. Okay, so if you see the technical term beaded hair is monolithics. Just try and remember that one. All right, what behavior best explains why a client may be dealing with pediculosis capitis? The client is in spaces such as bathrooms and swimming pools where proper cleaning and disinfecting procedures are not used. The client is not being careful about limiting contact with other people's heads, both directly and indirectly. The client's hair care makes use of excessive chemical and thermal treatments, so the client consumes a diet poor in nutrition. All right, so here's the thing. You got to know what pediculosis capitis is. What is pediculosis capitis? Head lice. That's it. That's what it means. So if we're talking about head lice, what do we need to be careful? We need to be careful that we are limiting contact with other people's heads, both directly and indirectly. None of the others make sense. Poor diet, doesn't have anything to do with it. Chemicals, nothing. Swimming in pools, nothing. But coming into a correct contact with people's heads, directly or indirectly, is where you're going to get pediculosis capitis from. So that is the answer. Let me just double check. 6 is B. Number 17. What is the cause of pityriasis? Parasite, gene mutation, bacterial, or fungal? I do believe it's a fungal infection. Number 17 is D, fungal infection. So pityriasis is a fungal infection. It doesn't come from bacteria. It's not coming from a parasite like lice. It's definitely not a gene mutation. It's just a fungus infection. Pityriasis. Number 18. If a client's hair is brittle and there are circular shaped lesions on the scalp with red spots at the opening of the hair follicles, the client is likely infected with Malassezia, Tinea capitis, Sarcoptes scabies, Streptococcus. Okay, let's eliminate a couple of these. Streptococcus has nothing to do with it. Scabies it's not on the head, I don't believe. So, and Malassezia, never heard of it. Don't know what that means. Probably has something to do with the head or something, but I don't know. So the only one I really like is tinea capitis for number 18, red spots opening the hair follicles. Tinea capitis is probably your answer. Number 18 is B, tinea capitis. So those are going to be circle-shaped lesions on the scalp with red spots. All right, number 19, a cosmetologist is able to provide treatment for. So which one of these are we able to provide treatment for? Seborrheic dermatitis, scabies, trichoptilosis, or folliculitis? Well, I know trichoptilosis is the one that is like breakage hair, split ends, breakage. So because it has the word chop, right? So when I see that, I'm supposed to cut the hair. So number 19 should be C. Yes, is C. Trichoptilosis is what you can provide treatment for. An example of a parasitic infection. That's a very big word right there, parasitic. So there's other infections. These are all infections. But the only one that is a parasitic infection is going to be your pediculosis capitis, which is nothing more than head lice, right? We talked about that. So parasitic infection, a head lice is a parasite. None of the others make sense. So number 20 should be D, yes. Number 21. What is the most appropriate process to distinguish pityriasis and pediculosis capitis? Oh, I'm assuming it's because there's a head lice. All right, let's see. Examine the scalp closely to determine whether the foreign matter is loose or attached to the hair strands. Well, I like that because if they have knits, those are going to be attached to the hair strands. But if they have dandruff, then it's going to be loose, right? It's just some foreign matter on the scalp. B, examine the scalp closely to determine whether the infection affects the tissue around a singular hair strand or whether the infection is clustered. That has nothing to do with it. Consult with the client to determine whether the client is experiencing itchiness or not. That is, obviously you're going to want to ask that, but you can look at the hair and discover that yourself. Examine the scalp to determine whether the infection has a distinct odor or not. Don't care about that whatsoever. How are we going to distinguish between dandruff and head lice? That's what it's asking. So the only way to do that is to decide whether it has foreign matter is loose or if it's attached to the hair strands. Because if it's attached, then it's knits, right? The knits attach themselves to the hair strand, usually about an inch or so away from the scalp. Sometimes it goes all the way down the hair strand if you've had it for a while. But that's what they do. They attach themselves to the hair strand. All right. Number 22, What is a severe type of dandruff characterized by an accumulation of greasy or waxy scalp scales mixed with sebum? Okay, I think the big clue here is the one that's mixed with sebum. Pityriasis capitis, tinea favosa, pityriasis papules, or pityriasis steatoids. I believe it's A, but let me look. 22, it's D, steatoids. Pityriasis capitis is just dandruff. What's the difference here is the fact that it's mixed with sebum. That's where the steatoids comes in. So the pityriasis capitis, yes, is dandruff, but pityriasis steatoids is mixed with sebum. So that is going to be your answer for number 22 is D, pityriasis steatoids. Number 23, what term refers to an acute, localized bacterial infection of the hair follicle that produces constant pain? That's a big one. Alopecia can't be it. Let me just look real quick because I think I know the answer. Yeah, that's what I thought. Capitis, that's just dandruff, right? So, and tinea is just the head. So the only one that makes sense is a furuncle. Furuncle usually has, it's a bacterial infection. It usually has pus. It's very gnarly and it's very painful in that little area. So furuncle is going to be your answer. Number 24. What is a scalp disorder characterized by dry, sulfur yellow, cup-like crusts on the scalp? Tinea capitis, pediculosis furuncle, tinea favosa, or tinea barbae. I can eliminate some of these. The dry sulfur yellow cup-like crust on the scalp is kind of your big clue, right? So barbae has to do with the beard. Tinea capitis is just dandruff. It's not dry sulfur yellow cup-like crusts. Pediculosis furuncle has to do with your feet. Tinea favosa, I believe, is your answer. Let's look. 24 is C, tinea favosa. That's the only one, and you're going to note it because it has the dry sulfur yellow cup-like crust on the scalp. None of the others are going to say that. So tinea favosa is your answer. All right, number 25. Trichoptilosis is the technical term for what? Split ends, hair loss, knotted hair, beaded hair. Remember we talked about the word chop, right? That's right there in the word trichoptilosis, right? So chop is what you're going to do because their hair is split. So 25 is A, split ends. So I hope this helps. Go over it before you take your test. See if it can help you remember a couple of them, get your mind going in the right direction. This isn't a very hard one, but there's certain things that you just got to know, right? You got to study. It's not going to come to you through osmosis. You're going to have to study for this test. So hopefully watching my video will help. And I'm going to work on some more of them. Hopefully eventually I'll get them all done. Not that you need to know that in chapter 8, but just stay tuned. We're going to get there. So good luck, and I'll see you next time.